when lives are on the line.
Are there any obvious injuries?
These men and women will risk theirs
The lad who was driving got blood coming out of his face.
to save yours.
RTC truck.
They deal with the most serious injuries.
The patient is described as bleeding heavily.
Directly below his ear.
There's a lot of blood there.
The most critical illnesses.
The reports of a male who's in cardiac arrest, and without any action, the patient will die.
The two Yorkshire Air Ambulances cover Britain's biggest county.
He's fallen 30 foot from the roof. Oh yeah. He's got a big cut to his head.
5 million people rely on them
All right, sorry, sweetheart.
to deliver cutting-edge emergency medicine
We're just going to go to sleep. He's not looking particularly good.
at high speed.
If you can activate your major hemorrhage protocol.
Every day brings high stakes.
He's gone forward to this person, the tractor's just rolled forward and he's ended up squashed between the wall and the wheel.
Yeah.
I know you are, Flower. We've gone to get a special blanket to warm you up.
High risks.
I've fallen right on the hip. Being outside in the cold with any sort of traumatic injury is not good for you. So we wanted to get him off as quickly and as safely as possible.
I can't even sit upright.
And high drama.
He was sat on the top of that roof when he slipped off.
Whereabouts is it worse? Just in your hip?
Same place,
Yeah.
We've got so many things that we need to know as part of our job that there's pretty much never a time really when we can't kind of keep learning and improve our knowledge.
It's the start of the shift at RAF Topcliffe, and paramedic Gemma is swatting up on the latest medical research.
We're always reading new things, new articles, books, anything just to keep us as up to date as we possibly can be to deliver the best care to our patients.
And now it's time to put the research into practice.
You all right, I'll get in?
Jump in, mate, jump in.
Helimed 99's being scrambled to the Yorkshire Dales, with Gemma, Lisa and pilot Owen.
Okay, so engines above the flight.
Flight engaged.
Yeah, doors, harnesses and stretchers.
Time, lock, secure, front right.
Good in the back. And we are good in the front.
We are clear right, minute 39. Bit of a drift to the right as always. Okay, so taxiway's clear, clear area departure.
AirDesk 99 lifted.
It's freezing, and in the hills, snow has fallen overnight.
We've been called to Oswick, which is out past Grattington and Settle out in the Yorkshire Dales, to somebody that's trapped under a tractor. That's the only information we've got at the moment, apart from our air desk dispatcher, because he's listened into the call, and he sounds to be in quite a lot of pain. There's no other resources on scene as yet, so hopefully we'll get further updates before we get to scene.
AirDesk 99, go ahead.
Just for info, really, I'm setting off 98 as well, just because it does sound like it might be a nasty job. I'm still trying to dig around and get an update and find out exactly how he's trapped and what the situation is. But yeah, that's as much as I know at the moment.
Our HEMS paramedic on the air desk today has just updated us. They've made the decision, having listened in further to the call, that they're going to send our Nostal aircraft as well, which has a doctor on board.
A farmer with his leg crushed by his own tractor is serious. And with 30 farm workers killed every year, speed is of the essence.
When we all arrived into work this morning, it was as low as -7, so and trauma and cold don't go together very well. It can interfere with bleeding and clotting and all sorts, but it's generally not a good thing. So we need to get somebody on scene as quickly as possible, start that clinical care and get the patient out of the cold and off to hospital.
99 from Air Desk.
AirDesk 99, go ahead.
Quick update from scene. Sounds like it's probably a femur fracture. He's left the brake off his tractor and it's rolled over his leg. It's still trapped underneath, but I don't know if there's any sort of crush or anything.
AirDesk 99 are all received. He's still trapped. I'm presuming we've got fire to get him released though.
Yeah, fire are on scene and they're working to try and get him free.
Right, so it looks like that group of farm buildings there, doesn't it? Just on that little hillock or a little bit of a hill.
Just kind of to 11 o'clock?
I think you can see a fire engine, I think you can see a DCA.
Oh yeah, right,
Yep.
I can see visual, yeah.
Okay.
Yeah.
Yeah, so what I'll do then, the wind is from 12 o'clock now. Are we all happy in the back?
Yeah.
See where they're going? The top of this little hole here is a bit flatter.
Yeah.
I know it's a bit further than seen, but it's a lot easier for us. Right, is any snow getting kicked up there, guys?
No.
I've got good markers there, that's all good. Have a feel for the ground now.
Oh, good.
Cheers, mate.
Happy?
I'm happy.
Unbuckle him.
Leave to the 3 o'clock, please.
Yep.
Local paramedics are on scene, but the man is trapped between the tractor and the wall.
Hello, George.
So he's been complaining of lower C-spine, upper thoracic pain. We've got pain to his sternum area when I've been pressing on it.
Right.
And the majority of his pain is down this right leg.
Okay, so he's gone forward to this post and the tractor's just rolled forward and he's ended up squashed between the wall and the wheel.
Yeah, but he did say to me that it's gone over him. But
right. And he's been in this position ever since you seen
lower
him?
down. As soon as I came, he grabbed on my leg and pulled himself up.
Right, right, okay. So has he managed to move then? So his chest hasn't been trapped?
He's sat himself up while holding on to me.
Right, okay.
Firefighters are working to release 85-year-old George Horton.
If we can get enough pain relief in him, we should be able to move him now.
Gemma, will you get us Gerritherm, please? Yeah.
Lisa's first priority is to warm George up, using a Gerritherm, a specialist heated blanket.
George? Where are you? Let's have a look at you. Hello, George. My name's Lisa. I'm one of the paramedics off helicopter. Where are you hurting?
My legs, it's run over my ankle.
Right, okay.
Wheel run over my back.
It ran over you. Has it gone over the top of your chest?
Tried to come forward. I don't know what they're
Oh dear. All right.
George's right leg was run over by the tractor, which then pinned him against the wall. Thankfully, the tractor stalled before crushing him further.
What about round here?
They're all right.
Does that feel okay?
Yeah.
That
Just my ankle in my back.
What about your chest?
That's all right.
Does that hurt?
Just a bit.
Right,
No, not too
okay. All right. I know you are, Flower. We're going to get a special blanket to warm you up. Right, we'll get some obs and then try get something a bit stronger drawn up for him.
The second Yorkshire Air Ambulance is arriving, with the doctor on board.
He's complaining of his right ankle and he's complaining of C-spine. So we're going to get him out on longboard once I've got a full picture. So I'll just have a little listen. I'm just going to have a listen to your chest, George. Have you got any problems breathing? Nice deep breath.
So he's currently kind of on the floor between the tractor and the fence post, which is making it a little bit difficult to assess him. So we're going to put him onto a spinal board, drag him out, and then we can assess him a little bit better once he's out.
Are you all right, George? Cold, I'm cold, but you are.
So it sounds like he's got a bit of reduced air entry at left side. So we could just do with getting him out and have a proper look.
George's breathing is a concern for Lisa. She's consulting Dr. Johnny about his treatment.
Right, so my plan is going to be plan A to just try assist him up, see how we fare with that. I haven't really been able to properly assess the pelvis because of how he is and where he is. So we'll need to be really careful while we're doing it. And if we're not happy, we'll pop him back down. Plan B is get the longboard, slide it under his bum and pull him forward and get him out. Is that okay?
That's absolutely fine, yeah.
Cool. Should we give him a bit of ketamine now, just to help us get him across? So when we get him out, we'll do a quick top to toe again, and we'll have another listen to his chest. I think he might have reduced air entry left side, lower. So if you won't mind doing that, I'll have a look at pelvis and just double check everything else.
Lisa is waiting for the painkiller to take effect. Crush injuries can be fatal.
We'll start moving at that in a minute, while he's got the effect of it.
Very funny.
Yeah, that's some medicine we've given you. It's perfectly safe, George. Right, guys, is everyone ready? On my set, ready, steady, lift. Brilliant. Everybody happy? Yeah.
At last, George is free of the tractor wheel.
Right, we'll just do a quick exposure, Gemma.
So you've got an open fracture of the right ankle, guys. It's going to be a bit sore. He's got some deformity here and it just needs bandaging.
Right.
George has a bad ankle fracture and possibly a pelvic injury.
Gemma, what did you think to his chest?
I had a good feel around it. There wasn't anything untoward externally, but listening to it, I can't hear anything because he was making that noise.
Right.
Gemma and Lisa still have concerns about his chest too.
Ready, steady, lift. So we're just going to take back at ambulance. I'm thinking he's going to trigger step 2 to go to a major trauma centre if we can't hear anything in his chest.
Yeah, I mean, we can't rule it out, can we?
No.
This job has been a bit close to home for one of the firefighters.
He's actually my uncle, and it looks like he's got off the tractor and either the tractor's jumped into gear or he's caught the lever when he's got off on the transfer box, and it looks like he's strapped him against the gate.
Has his sets come up yet, Gemma?
No. Got good chest expansion.
Yeah. Just can't hear out in bottom of that left-hand side.
Okay.
Which would tie in which side that we're nearest to tractor.
Yeah.
So I think we should just get this pelvic binder on, try get some of these clothes out, and let's just go.
Because of their concerns about his chest, which could be a sign of serious lung problems, George needs to be seen at a major trauma centre.
Hiya, it's Helimed Air Ambulance here. We've got an 83-year-old gentleman called George complaining of central neck and back pain, query reduced air entry lower left side of his chest. He's got quite a nasty laceration, open fracture to the right ankle area. He's had a gram of IV paracetamol, he's had 6 milligram of morphine, he's had 20 milligram of ketamine.
So we need to basically just put him in head first.
And we'll be with you in about 15 minutes.
All clear, left please, mate.
Clear left.
George's crushed ankle will require surgery, and until he's x-rayed, the team can't rule out life-threatening internal injuries. He's being flown to the major trauma centre in Preston for urgent tests. Temperatures across Yorkshire have been below freezing for days. Paramedic Rachel knows that getting through the shift ahead will be all about the layers.
It's not unusual for you to see me walking around Topcliffe Base with like 3 coats on. So I'll have my gilet on, which I've got on underneath here at the moment, which is just like a body warmer, just to keep the main core of me warm. Then I'll have my own coat, which is like a really good one at like keeping you warm. And then I'll have my fleece over the top with my hat on, my gloves, because I don't do well in the cold. I am always cold, so to be cold as well just don't make it particularly pleasant.
The scramble phone is ringing.
You are going west of Moulton.
Dispatcher Sammy has a job for the crew.
59-year-old male, cruelly fractured hip whilst out walking. The track, you may get a DCA to, but they're 35 minutes out.
Rachel is on board Helimed 99 with pilot Colin and paramedic Matty.
Air Dash from 99, we've lifted Topcliffe route into this incident, over.
99 lifted.
Oh, I'm already shaking, I'm that cold.
Oh, let's put some heat on, shall we?
We're heading out to a walker who's fallen whilst out. I think it might potentially be a little bit difficult access for a DCA, that's why we've been allocated by Sammy down on the air desk. We haven't got any more information from other than that. He may have hurt his hip. It's absolutely freezing today, so he's going to get cold very, very quickly. So the longer he's on the floor, the worse it's going to be for him. So hopefully we can get there. If anything, get him up, get him warm, keep him warm, and then hopefully get him to hospital.
The temperature outside is around -3, with the wind chill making that even lower. In trauma cases like this, the cold can be fatal.
It's down here on the right. Got a car down the bottom there somewhere, and a few houses.
Should get a DCA to that, we have.
I've got somebody on a path, but they're not waving. And they're just behind that white car, down there on the track.
Yeah, the corner of that field. Do you want to come out just to the right here, do you? That looks a bit easier than down the track. Yeah, actually,
Watch
we can
those
see.
wires, Colin.
Yeah. Super. We'll just put it here, shall we? Then you straight down the road.
All good on our left, mate.
Thank you. A little bit of slope of ground nose down by the looks of it. Okay, put it down.
Hello. You all right?
59-year-old David Barlow was out doing his daily walk with his partner Jan when he slipped on the ice. They were just 15 minutes from home.
So what have you done to this morning, this afternoon even?
So we can get him out cold.
I've fallen
Thank you very much.
right on my hip.
Right on your hip?
Right on my hip.
Yep. Did you feel anything, hear anything when you landed?
A crack.
A crack?
It was a loud, well, it might have been a crack, but it was that kind of noise.
Right, okay.
I can't even sit upright.
All right, okay, fair enough.
And when I try and lie back, it's just agony.
Okay.
I've just asked the guys just to get the stretcher, we can get him straight off at cold floor then.
Yeah, shall I get him to grab the Entonox as well? Because he'll probably need that for moving.
Rachel's going to come back with some laughing gas, some Entonox. It's really good for bony type pain.
Yeah.
Just till we facilitate moving you, then we'll give you some really strong pain relief. All right, mate?
Thank you.
Right, mate, this might make you feel like you've had a couple of shandies, okay?
Yeah.
You bob it in between your teeth and suck on it like you're sucking on a straw, okay? So that's it.
And I say if it does make you feel a bit woozy, that's normal, okay?
That means it's doing its job.
Rachel and Matty know they can't waste any time getting David into the warm. If he's bleeding, the cold could stop his blood from clotting.
We're just going to put this hard board behind you to roll you onto it. It's the quickest and safest way to get you off the floor, okay? We'll put you straight onto our stretcher and we'll get you into the ambulance, my friend, okay? And we can have a real good look at you there.
So just bear with us, because this bit's going to be the most uncomfortable bit, okay, while we get you over. Hopefully once we've got that little bit of pressure off your hip, it won't be quite as uncomfortable, yeah? Right, bob that back in, sweetheart. Take some nice deep breaths. We'll have 2 or 3 really good breaths and then we'll move you, all right? That's it. Right then, David, when you're ready, sweetheart, we're going to roll you onto your back, all right? That's it.
All right, my friend. You can carry on taking those big breaths. That's it. Nice big breaths, mate.
Maybe get under this leg. Yeah. Just try and help him across.
Nice big breaths, buddy. Good.
Just keep nice deep.
I got it. Nice big breaths, mate. Nice, slow, deep breaths. Absolutely brilliant, my friend. Well done, matey.
Have you got pain in the arm, David? What? Have you got pain in this arm?
No.
No, just your hip. That's it.
Well done. Deep breaths on that Entonox.
The team suspect a break at the top of David's femur, the longest bone in the body, and the most painful to break. It's no wonder he's distressed.
I'm so sorry.
No, it's okay, David. Breathe this gas in, my friend. Good, man.
Right, that's the hard bit done.
Yeah, everybody happy?
On lift then. Ready, steady, lift. How do you feel now you're off the floor?
It's obviously just my left hip.
Just your left hip.
What a time to do this.
With David in the ambulance, Matty and Rachel can assess him out of the elements.
David, we're going to have to strip you off, sweetheart. I know you're cold, but we'll get the heating on, all right?
It looks like he's broken his hip, okay? So what we're going to do is we're going to treat him for a broken hip.
Okay.
Like I just tried to explain there, being outside in the cold with any sort of traumatic injury is not good for you. So we wanted to get him off as quickly and as safely as possible.
Okay.
He's in our office now, it's a lot warmer, we can cut his clothes off and have a good look at him. If we do that out here, it's going to make him a lot worse, okay?
Yeah, okay.
So we've given him the gas and air just for a little bit of pain relief. That's only like mild pain relief. We're going to give him some really strong stuff now, okay?
Okay.
And then we'll probably pop him to York Hospital.
Right.
Okay?
David, take his boots off your left leg, all right? And support your leg for you. There we go.
Do you want some more of this Entonox?
There we go. Did you just slip on the ice then, David, and go down?
Yeah. Small scratch, David, on 3. Right on it. Right on the hip bone.
Did you hear it then when you went down?
Yeah.
Air desk, medic 1.
Medic 1, catch your message.
Hiya Sammy, yeah, we've literally just scooped this gentleman off out of the snow into the back of a DCA. He's had some Entonox. Looks like he's got a left-sided neck of femur fracture. He's got obvious shortening and external rotation. We haven't stripped him off properly because it's absolutely freezing. We're just trying to get some pain relief on board and I'll update you further, over.
David, I really need you to relax this right arm now, sweetheart. Nice and relaxed, nice and floppy.
He's fairly stable, all his observations are okay that we've taken. Rachel's managed to get a really small cannula in, so the gentleman's now having some really strong pain relief. He's having some IV paracetamol, he's had some morphine. He's also had some anti-sickness medication because it's going to be a little bit bumpy on the way in with these icy roads. So yeah, he's nice and comfortable now. The main thing is he just gets hospital and has a quick x-ray, see if he has actually fractured his hip, which it does look like he has done. and then he'll need some input from the orthopaedic team at York.
Right, David, take care of yourself, sweetheart.
Thanks ever so much.
All right, and I hope you have a speedy recovery.
Thank you.
All right.
The weather conditions mean David will be driven the 14 miles to A&E in York by road. He'll need surgery on his hip. Last year, the construction industry saw more deaths than any other profession. 40 people lost their lives in the UK. Nearly half of those accidents were falls from height. And today, the team are being tasked to help a builder who's fallen 10 feet.
Right in the middle of town.
Is it?
Oh, nearly.
Falling off a roof.
Okay, clear right? Clear left.
Clear left.
15.
That's from 99. Ty, can I just see if you've got any further information and just confirm location as well, please, Dora?
The patient is conscious. He's fallen off a roof with chest and hip injury.
Pilot Colin is flying paramedics James and Steve 20 miles on board Helimed 99.
If it's a fall from height, obviously the main concern will be spinal injuries, a head injury. He could fall something like onto his pelvis or onto a long bone. All things that, areas there that could bleed into quite sufficiently. So again, it's important to get there to discover if he is bleeding. Thinking about things going through my head now is, things like TXA and things like that, or splinting bones that could be bleeding into, or possible open fractures.
Their patient has fallen in the medieval city of York. Colin's using his local knowledge to find a landing site.
Right, we follow the railway line to the railway station. Down to the railway museum, we turn right, and then there's like the row of terrace houses, a school and some open areas, so we've got to identify it there.
No worries. DCA, 1 o'clock.
Visual,
1 o'clock now.
This school fenced?
It looks fenced, doesn't it? It looks like one of those green anti-climb ones. Yeah, it is. Yes.
He's homing in on a school playground.
These football posts look like they could fly away, Colin, just so you're aware.
Yeah, I'm just keeping the height up this side here. Got one to the right, 2 in the 12.
Goalpost is stationary to the right. Do you want me to jump out and go ask them if they can let us out the gate?
Yeah, might as well.
Before you shut down, yeah?
Thank you very much, thank you.
100 metres down the road, their patient is in the care of ground paramedics.
Hello there. Hello there. Hi, my name's Steve, this is James. What's happened?
He's been working on that roof, it's about
8
foot high. He was sat on the top of that roof when he slipped off. He's landed on his left-hand side.
Okay.
In a lot of distress when he got to, so I've given IV 10 mil of morphine and a gram of paracetamol. Which is
Okay. Okay, Alfie, just breathe normally for me, nice in and out.
Hey, pain and stirred hip.
That's the hip.
Okay. Yeah, stirred hip.
All right, sorry about that.
54-year-old Othie Sykes was working on the house with his son-in-law Hope when he fell backwards off the roof.
He was at the top repainting the ridges and replacing all cement and whatever, taking the old put no in. And he was sat on it and it went back too far. Anyway, I was meant to take a phone call from the bank, and as I went to take the phone call for the bank and walk from there to there.
Any pain in your legs here, Alfie?
No, just in the butt.
It's been okay.
Taking my ass,
I think he's smashed all this. I think he's smashed all, like, this part of his body.
Right, Alfie, I'm just going to cut through some of this gear, okay, so we can have a little look at your hip, my friend, okay?
So he's had 10 of morphine.
And a gram of paracetamol.
Gram of paracetamol, okay.
As my father-in-law, see, I'm married to his daughter, and we're working for a while by me here, and it's just one of those things. Like, accidents meant to happen, and it happened.
I'm happy with his chest, so we can have some Entonox. So can you just go and grab Entonox for us? Perfect. The femur looks all right, doesn't it?
Yeah, femur felt fine. So is it round the back here where your pain is?
From there now down to, yeah.
Down to your bum.
The Entonox, or gas and air, will relieve Othie's pain while James and Steve prepare him for his journey to hospital.
So I think it's a case of stretcher out and then we'll get him onto the scope. We're going to draw up some more morphine, Alfie. Just keep going on the Entonox in the short term, OK?
The location of Othie's pain could indicate a broken pelvis. It can lead to lethal internal bleeding and damage to internal organs.
Keep going on the gas in here the minute.
Worcesters have been taking the gas, mate.
It's worse.
It's worse?
Yeah.
Whereabouts is it worse? Just in your hip?
In the same place, yeah.
Yeah, no pain anywhere else, though?
No.
No, OK.
The team are using a scoop stretcher. It's specially designed to move trauma patients, lessening the risk of bone fragments causing further injuries.
Right, Alfie, you keep taking that as your best friend for the next few minutes, okay? We're going to go on slide, guys, okay? 1, 2, 3, slide. Perfect.
As he has a suspected pelvis fracture, the team will be flying him to the nearest trauma centre.
We're looking like we're probably going to go to Leeds. He's had 20 milligrams of morphine. At the minute, he's hemodynamically stable.
The good news is Oathie's blood flow is stable, but his injuries are severe.
Yeah, we've just arrived at the school. We're going to load this patient on. If you can contact LGI for us.
It's a 10-minute flight to Leeds General Infirmary.
So obviously it's a priority to get there, give him a good trauma assessment head to toe. Before we get that assessment done quickly to discover if he has any life-threatening injuries.
Oathie will need emergency surgery.
Freelanders, doors, harnesses and stretcher.
Close the secure front right.
Yeah, all secure in the back.
And close the secure front left.
Orthopaedic surgeons are on standby for his arrival. He could be in for an extended stay.
The top of tower start, runway 20 right hand, QFE 1018.
It's an icy morning at RAF Topcliffe, and paramedics Andy and Pete are preparing for a cold day.
First thing in the morning when we come on is prep the aircraft, so we have all the checks, the aviation checks to do, but all the clinical kit that we've got on board as well. It's going to be a cold day today again, so some of the equipment that we don't use perhaps that often, like the heating blanket, we need to make sure that's fully charged. We have our Flecton, which is a very large sort of sleeping bag that we encase patients in, and those type of things can make a big difference, as well as the clinical interventions that we have.
The first job of the day soon comes in. Pilot Harry will be flying them to a town on the edge of the Yorkshire Dales.
Okay, Richmond.
Richmond, yeah.
We'll lift and go out to the right there. Turn left round the hangar back into wind. Turn left once to get down the corner, that'll put us more into wind.
Looks like it's on a residential street, this. Okay.
Heavy snow has been falling in parts of North Yorkshire over the past few days. The plummeting temperatures could add an extra complication to this emergency.
We're just on our way to North Yorkshire. It's quite an icy morning again. We've got reports there of an elderly patient fallen in the street and sustained a lower leg injury. But the call has reported that there's an open fracture and it's badly displaced. So there is a crew attending, and we've been sent to see if we can give some additional support. If you've got an open fracture, then there's a huge potential there for increased infection within the wound, which can delay recovery. And then we've got the added problem at this time of year that hypothermia to set in with the patient as well.
So there's our school.
Yep.
There's that patch field next to the big long building, isn't there? Yeah, that's pretty much where...
Got DCA, have you got it low at 2 o'clock, Harry?
Yeah, visual, yeah. Okay, so wind's on just to the left at the moment, so we'll come back round a full 360 to land where there as discussed. What I'll do, Pete, is I'll just go and land up this top end near that gate if I can, because then if we need to convey, the DCA might be able to get quite close to us.
Yeah, okay.
It will depend on the slope, but if I can, I'll put us there.
Okay.
Yep. Upper motor out. Okay, snow's holding firm there.
Moving.
Yeah, just going to bring us a little bit round to the right there and take us up to this corner. That seems pretty good for limits. Yeah, that's well within limits as it settles into the snow. Right, yeah, that's all good. You're clear to unstrap.
9-9 landed.
Pete now faces a tricky walk in the snow to where the accident happened.
Unfortunately, due to it being in a sort of residential area, we've had to land in a field on outskirts of town. So we're just making us way down, made a bit more hazardous by obviously the standing ice and snow that's still around.
Pete's patient has been taken into a ground ambulance by local paramedics.
Morning. How you doing? Good. Just come in and shut that door.
Val, 83, 9:30. She's fallen across the road there.
Yeah.
Isolated, left fracture, distal tip fib there. She's tried to walk with assistance on that across the road.
Right.
83-year-old Val Warner was walking across the road to her home when she slipped on the ice. It was her first time outside the house in months.
Hello Val, how are you feeling now? Just cold, which been like pain. Why is that a wee?
Hard to give her, she's in agony, bless her, but she's not giving a pain score.
Yeah. How is it feeling for you at the moment?
It's just hurting.
Just hurting.
Val's neighbour saw her fall and called over her son Michael.
She was taking a card over to Miss Buxton here. She was on her way back and she just slipped on the ice. So they came out, tried to get her over here, but then she stopped here. She said her ankle was broken. By the time I got here, she was already in the ambulance.
Are you able to move these toes for me?
I can move them, but it hurts.
It hurts. If I just touch down here.
Feel it.
Great stuff. And here?
Feel it. Yes.
Can't believe it, really. They've been shielding for months and months, you know, with the virus.
So, your thoughts on that? So we have got peel.
Yep.
Obviously we've got.
Yeah.
What? Yeah.
All right.
So I wasn't going to pull that.
Yeah, she's got a fetal pulse
Yeah.
and she's got sensation.
And we've just said so.
Yeah. Pain level at the moment. She's in a lot of pain.
Yeah.
A lot of pain. Yeah.
A bit more settled than perhaps she was. She's had 2.5, so it's the second 2.5 going in.
Yeah.
Pete is concerned that Val's age could mean she's at a high risk of a serious infection. They need to get her out of the cold to hospital.
You need new central heating.
Say again?
You need new heating.
How long have you been outdoors for?
Maybe it's quarter of an hour, 20 minutes. On
Right.
Ice and snow.
Yeah. Fine. Sorry about that.
The team are dressing Val's ankle for her journey.
So our plan is to actually take you up by helicopter to James Cook. Because of the time it's going to take you to drive and because of the injury you've got, we don't want to bump you around any more than we have to, okay? Medical background with this lady. Look.
Didn't get it. My colleague might have got it.
Fit as a fiddle, yeah? As far as recently, you've not had any new coughs or anything? And,
No, I had my vaccination last Thursday.
Did you?
Yes.
How did you feel after that? Were you all right?
Fine.
Yeah, great stuff.
The helicopter flight will save Val a long, bumpy ride to Middlesbrough in the back of an ambulance.
Val's got an isolated injury. It's quite a nasty fracture and it's going to need surgery. As it is at the moment, thankfully, we don't need to relocate it. She's got good sensation and pulse beyond that. But obviously, it does need attention in hospital. The guys here have got a 45-minute drive to hospital, and that's providing all the roads are clear. So the plan is to transfer Val across to the aircraft and give her a much smoother and quicker flight into hospital. And she suffers arthritis. She's had lots of sort of surgery in the past, knee, hip replacements, shoulder replacements. So, you know, I think this is going to be quite a serious injury for her. On your call at top, guys.
Ready.
Good morning, it's Pete on Helimed. We're bringing your patient in from Richmond. Can I pass you some details, please? We've got an 83-year-old female. She's fallen on ice and she's got an isolated lower leg fracture or ankle fracture. We've not tried straightening it out because obviously it doesn't look compromised at the moment. Everything else is fine. It's just trying to get some analgesia into her and we'll be with you in about 20 minutes.
The team are familiar with the dangers that snow and ice can pose.
Although most of the snow has cleared in most areas, certainly up North Yorkshire, there's still patches where it is treacherous really. From us leaving the aircraft and getting down to the patient, it was very slippery underfoot. And it can be quite deceiving because you think it's clearing and then there'll be a patch of ice. And I think this lady, she's managed to get out, she's visited her neighbours to deliver a birthday card. And it's just on her return back, she's slipped at her back door. She is very active, and it's probably by being active today and being out has actually caused the sort of downfall, which is a great shame when people, you know, are out and trying to get around and do as best they can.
After months of shielding from the virus, Val now faces hours of surgery at the James Cook Hospital, the result of her first trip outside her home since lockdown. It's February, and heavy snow is falling across Yorkshire. At RAF Topcliffe, paramedics Lisa and Gemma are getting warm between jobs.
He says, how's out towards Thornton le Dale looking?
Thornton le Dale? Yeah, should we come around the edge and up into it?
With pilot Colin giving the go-ahead to fly in the snowy conditions, the team are setting off on a job.
Right, don't like it, we'll turn around and come back. It's just northwest of Leeming Mats. We've got the A1 to follow. I don't think there's too much to worry about on the way up there.
If conditions worsen, they may not be able to reach their patient.
Yeah, it's all very wet now, isn't it? Like I say, temperature's positive.
ADS 99, we've lifted.
DCA is signed to it, they're showing 4 minutes away.
Okay, we're going to be about the same time then.
The only thing, no further update on the patient is yet. She's fallen from the horse, couldn't feel her legs from the waist down.
A professional rider has come off her racehorse. The weather makes her situation even more precarious.
There's been a little bit of delay for us dispatching. The ambulance will take a little while as well. Obviously, it's a snowy day and this patient has fallen a little bit of time ago, maybe 20 minutes ago now, so she's going to be really cold, whatever injuries she's got, so we need to bear that in mind and try and assess her as quickly as we can and move her.
Got the A1. I might follow that up actually because it's a good visual reference.
Are you happy with this?
Well, we've got 600-foot cloud base, so if we don't like it, we can come down.
The snow is getting heavier, making visibility worse.
Closed in a bit, hasn't it?
Yeah.
Yeah. We're just going around a shower. Yeah, that's fine. Are you happy with it still?
Well, I am, because I've still got references and it's patchy stuff.
Yeah. So it should be just out to our 11 o'clock somewhere. In fact, I think it's just this on the nose.
99 from ADS. Just spoke to the crew. You need to be about a quarter mile south. It's on a main road towards Hackthorpe.
Possibly that road over there?
Yeah, it might be mine too. Is that the DCA there at about 1 o'clock? Yeah.
Gully.
Good spot.
Oh yeah, people in that field as well on the right.
Yeah.
Don't go in the trampled area just slightly south of there.
Now we've found the crew visual for landing.
Might as well just put it on these tracks here, I think.
Yeah. You're all good left. You're getting a bit of a white out.
Picking up. Got the references.
Good left. Good right. ADS 99, we've landed scene.
So we weren't really sure whether we'd actually get to scene, but we managed to sort of beat the bad weather and trek around the snow showers that were coming in. And you think that a bright yellow ambulance would stand out quite well in the snow, but when you're 500 foot up above or even a bit more, it's just quite tricky against the white background to get your landmarks that you normally would get.
Their patient is lying in thick snow. Lisa and Gemma will have to work quickly. Cold can be a killer in trauma cases.
Hi guys.
So this is Phoebe.
Yeah.
Fallen off the horse. She's gone. She's sort of fallen off on her legs and then gone down.
Okay. Where are we with anything else? How's she doing with pain?
Pain. It's just all in this leg.
Okay.
Breathing shed was fine. She doesn't think the horse has stood on her.
Okay.
Yeah.
Phoebe, hello. I'm Gemma. How are we doing? How's that pain?
Yeah, it's
It's hurting. Okay. And pelvis is.
Down through the legs.
Yeah, and everything was all right.
20-year-old Phoebe Robinson works with racehorses. She was riding one out today when the horse got spooked and knocked her off.
What caused you to come off, Phoebe?
The horse in front kicked out and mine
just didn't like it.
Yeah. I think we have been going to more and more what we call horsey jobs of late because people's social facilities and things are very much closed down at the moment, so you're limited what you can do to enjoy these strange times.
Not allergic to anything?
Penicillin.
You're allergic to penicillin. Have you had any pain relief today for anything?
No.
Because we want to get you out of the cold, can we just delay putting anything in your veins and then we can just get you to the ambulance? Is that all right?
I'd rather be warm.
I know, I thought you might, yeah.
But you've had better days, haven't you?
Yeah. It had to be a snow day.
So, we're going to go on lift. Ready, brace, lift. Nice and steady, just slippy. All right, Phoebe?
Yeah.
Gemma wants to give Phoebe pain relief and check her over. But the first priority is to warm her up.
Get fire on her.
Yeah. Get the log burner on.
Oh, if only. Maybe a hot tub.
We'll just come out.
Air Desk Medic 1.
Patient's GCS 15. The crew had already got her packaged on a scoop. So we've got her off the floor, into back at DCA. We're going to do a top to toe and then decide. I think we're going to struggle to fly anywhere.
The snow is making an already difficult rescue more complicated.
When we left this morning, we had 800-900 foot cloud visibility. Of course, now that it's been snowing a bit, the danger is that we're going to get settling snow onto the aircraft, so I'm going to have to go out and run it to clear all the snow off. A difficult day.
Phoebe, we're just going to put a splint on your lower leg because it just looks a bit swollen around your ankle. Yeah. So it should just kind of help it settle in a position, if that's all right.
It looks like it's just a lower leg injury, which, although it will be painful, it could have been a lot worse. So all our observations are in normal range. So today we won't be flying, she'll go by road to the local trauma unit, which is Darlington.
It looks like Phoebe, who's been riding for 16 years, has had a lucky escape. But she won't be saddling up for a while.
Go quite nice on the next Christmas cards, that shot.
The air ambulance team must return to base before the weather turns again. At hospital, it was found that Phoebe had damaged ligaments in her ankle, but she was released later that day. She spent 3 weeks recovering at home, but is now back at work training racehorses.
I'm cold. I know you are, Flower. We're going to get a special blanket to warm you up.
George, the farmer who was pinned against a wall by his tractor, needed skin grafts and 2 operations to pin and plate his ankle. He's thankful to the air ambulance team, who he says saved his leg.
Hello Val, how are you feeling now? Just cold.
Val, who slipped on ice during her first outing in months, fractured 2 bones in her leg.
The leg bone came out through the side of my foot, and you could see the bare bone, and then the ankle was twisted completely.
She had surgery and is slowly getting back on her feet.
At the operation, they pinned and plated my ankle. Afterwards, they put me onto a walking frame, and they said because of my age, crutches weren't very good. And I've been pottering around on the walking frame ever since.
She knows that day could have been much worse and is grateful for the paramedics' help.
I keep thinking, what if somebody hadn't seen me fall and how long I would have laid on the ice and snow. I'm just so thankful somebody saw it.
He was sat on the top of that roof when he slipped off.
Othie, who fell 10 feet off a roof, had a broken pelvis and ribs.
You can still take the Entonox with that hand?
He had surgery to pin and plate his pelvis and was unable to walk for 3 months. He's been a builder for 40 years, but has taken a break from it for the past few months.
I've fallen right on my hip. I can't even sit upright.
David, who fell while doing his daily walk, broke his femur in 3 places and had a 9-inch pin put into his leg. He's still recovering, but hopes he can walk his usual route again soon.